Preeclampsia. Anyone who's pregnant should know the signs and symptoms of this pregnancy condition. So
Today, we're going to talk about preeclampsia. What is preeclampsia? Preeclampsia is a disease condition that is related to pregnancy. Now, what causes preeclampsia? Preeclampsia results because there's an abnormal development of the placenta during the formation of the placenta. That's the early pregnancy. The vessels in the placenta are supposed to be wide enough to accommodate the blood flow. But in preeclampsia, the vessels are very narrow and there is resistance. When the blood flows from it, it's normally resisted, leading to release of a particular enzyme affects the blood vessels of the woman. Now, what are the signs and symptoms of preeclampsia? First of all, the BP of the patient is always above 140/90. You check the BP like 2 times and it's giving you 140/90 or more than 2 times. Secondly, there is protein in the urine of such a patient. Thirdly, the woman will complain about some visual disturbances like blurred vision and light insensitivity rather. Fourthly, there is headache, there is right upper abdominal pain, there is sudden weight gain. The patient just start gaining unnecessary or unexplainable weight. There is a puffiness of swelling of the face and the hand. And then there's also involvement of the major organs like kidney and the liver. Now, what are the people that are at risk of developing this condition in pregnancy? Number one, previous pregnancies. If you have been pregnant before, you stand the risk of developing it. Secondly, if you have had a history of preeclampsia, maybe in your previous pregnancies. Thirdly, if you are having a multiple gestation, yes, if you are obese, if you are hypertensive, and if you are diabetic, all these things will predispose you to developing this condition in pregnancy. Now, how do we manage it? Management of preeclampsia is strictly, the patient has to be on strict bed rest. Why? Because you need to do a close monitoring of this woman and the fetus in utero. You have to monitor the BP. Most times you check the BP every 30 minutes, and also you check the fetal heart rate of the baby. You have to have this woman in admission. Secondly, you also use some antihypertensive drugs like Aldomet, nifedipine, levodopa, and a whole lot of them, depending on what the management team wants to use on you and what's working for you. Thirdly, you have to also give this woman magnesium sulfate. Yes, it's an injection you give them to prevent them from entering into eclamptic fit. And thirdly, you also have to manage as other symptoms present. Yes. And now, what are the complications of this condition? We all know there's supposed to be a complication. That's what makes it a very critical condition for this woman. Complication might come in form of organ failure like liver or kidney failure. That could be stroke. There could be eclamptic fit when the woman has entered into eclampsia, as in having the fit, the seizure actually. There can be maternal death, there can be fetal death, and all of that. And then another one important thing we need to know is that the only very positive treatment to this condition, especially when there's a fulminating thing, like there is increased blood pressure that doesn't come down, and there's also involvement of organs, making you to know that actually it's really going out of hand.